Hello. I apologize for my English. I speak with my heart. How a shoddy and incompetent medical team prematurely ended my wife's life in a leading Sydney public hospital. I do know exactly how to categorize this hematology team of junior doctors, including the professor, director and director of the hematology unit. If they are illiterate about medicine, they should not be practicing in this leading Sydney and important public hospital. And if they are true doctors, then they should be accused of manslaughter for the inhuman and savage way they have treated my wife that caused her death by asphyxiation, drowned in her own fluids. My name is Antonio Riveiro. My wife's name was Mirta Riveiro. Her maiden name was Mirta Gladys Justo Mutuberria, and she was born on the 31st of March 1936 in Montevideo, Uruguay. I have to be brief, as this story, written in full, takes about 14 pages. What are your thoughts when listening to this video about a doctor, professor and director of hematology unit that ordered 5 blood tests to a patient and ignored all of them? Even his junior doctors ignored these tests. Had they spent just a few minutes reading the tests, the outcome for my wife could have been a different one. They could have learned that since admission on 11/02/08, my wife's albumin was low and dropping and needed to be treated. But this team, including the professor, failed to pick up the albumin levels, and the treatment my wife received was like tossing a coin into the air, heads or tail. The loser was my wife that lost her life just in 12 and a half days under the care of this hematology professor. He fixed her for eternity. Days before she died, she was telling me, "Tony, my breathing is getting very shallow and short. Tell the doctors I feel like 2-3 bricks on top of my chest." And the only thing the register did was telling me a few times, "Your wife is okay. She's only nervous and anxious." The medical profession all over the world is well aware that patients with albumin levels under 27 receiving intravenous fluids and intravenous medications lying flat in bed are at great risk of being overhydrated and fluid overloaded, and if not monitored closely and frequently, the patient could die by asphyxiation or drowning in her own fluids. My wife was admitted to this leading Sydney public hospital on 11th of February 2008 at 6:30 p.m. The following blood tests were all ignored. 11/02/08 at 7:54 p.m., the day of admission. Albumin levels was a little low, just at 27, ignored and untreated. The following day, 12/02/08 at 2:54 p.m., albumin level was even lower at 22, again ignored and untreated. 15/02/08 at 10:30 35 am. Albumin levels was even lower at 20. Shockingly still ignored and untreated. 20:02:08 at 10 am. Her albumin level was just at 16. Still ignored and untreated. Why? 25:02:08 8:30 am. Her last blood test. Albumin levels was only 14. Practically no albumin left in her body, and the hematology team, including the professor and director, were oblivious of the dangerous situation of my wife's condition. Albumin is a protein made by the liver and released into the blood. It helps to prevent the fluids leaking out of the blood vessels, and it carries medications and other substances through the blood. When albumin levels drop, fluids leak out of the blood vessels, and fluids can collect in the ankles as pedal edema, in the lungs as pulmonary edema, or in the belly as ascites. And if not treated, the whole body can become overloaded with fluids, and the unfortunate patient would die by overhydration. And that is exactly what happened to my wife. Albumin low levels is a treatable condition. Why didn't they do it to my wife? Albumin is given directly into a vein, intravenously. Dosage must be based on body size and weight, and closely monitored. Why did this hematology professor and his team ignore not one but the 5 blood tests ordered by them? And why was my wife allowed to swell without any control and without trying to drain her overloaded lungs and body by dialyzing her, where there was ample time to save her life?